This is a message for anyone that is newly diagnosed with ME, C.F.S. or post-COVID ME, C.F.S. What I need to make absolutely clear is that before COVID even existed, I, and like many other ME advocates and charities worldwide, were working very hard to make healthcare medical professionals understand what ME, C.F.S. is. 76% of GPs in a recent survey said that they thought that ME, C.F.S. is psychological. That's your starting point. Medics do not understand how viruses can trigger neurological disease. This is due to a lack of education. Because only around 5% of medical professionals worldwide receive training on ME/CFS, stigma that started decades ago filters down because there's no education to tackle that. Or at least there wasn't education until I set up Stripy Lightbulb in September 2018, and since Physios for ME came along around 18 months ago. It's still very early days in terms of educating people, and what really worries me is that COVID is a new illness. Long COVID is a new illness, but what isn't new is how bodies react to viruses in the terms of chronic illness. And I'm kind of getting a bit fed up with it's a new illness, we don't know what we're dealing with. The reason they say that is they have not had any training on ME/CFS. Physios do not understand why exercise doesn't work. They don't understand that exercise is like kryptonite to people with ME and CFS. So what I'm really worried about is that long COVIDs or newly diagnosed ME/CFS patients get their referral to specialist services and think, I'm being looked after, they know what they're doing. I personally have post-COVID stuff going on. I still have the viral cycle. I have organ damage, but I also had ME/CFS to begin with. So I know absolutely no way should I do any form of increased activity, or at least not without checking with Physios for ME first, because they are experienced ME-aware physios. So please, please, please do not go along to your specialist appointment and assume that they know how to manage your energy restrictions. Because if you have it's probably too soon for most of you to have a confirmed diagnosis of post-COVID ME/CFS or ME/CFS if you got sick at the start of the year. But if there isn't, what I would say is if you do any kind of increased activity without a diagnosis or with a diagnosis of ME/CFS or post-viral fatigue syndrome, do not do it. Listen to your body, because I've got a feeling this is going to be the PACE trial times 2. I've seen so many long COVIDs taking part in research studies that involve activity. You don't know if you've got ME/CFS yet, it's too soon. The researchers that are doing that research probably don't know about ME/CFS. Have they checked you against ME/CFS criteria? I really, really worry that we are going to have, like the article in Time magazine said yesterday, that we are going to have an epidemic of ME/CFS, and it's going to be worsened due to a lack of education. Any medics that are watching this, please do my training. That's what it's there for. The reason I include a training course for healthcare professionals is because I am well aware of the small number of medics that actually know anything about ME/CFS. There is a reason that training was created. It's to fill a gap in knowledge. Physios for ME are working very hard. So am I. So please do take a look at stripylightbulb.com. There is also a patient resource there. So if you want to know more about ME, it does cost £5, but it's around 2 hours worth of information to save you scrolling through Google. It explains why it's called ME/CFS, why patients don't like the term CFS. It explains that ME is a spectrum illness. It explains that there's no treatment and why that is, and why you shouldn't be doing exercise. stripylightbulb.com. Happy to answer any questions through ME Foggy Dog or stripylightbulb.com, but I do my advocacy with ME Foggy Dog. So yeah, please, please, please don't Listen to I've been told by my respiratory consultant to increase my exercise. I know that would absolutely destroy my ME, and I do not want to become house or bedbound. She knows I've got ME, but completely disregarded that to concentrate on my COVID symptoms. So I know that consultants don't necessarily understand about increased activity in ME/C.F.S. I've also heard anecdotally that many NHS trusts are setting up specialist support services, but the people at the head of those services do not know about post-viral illnesses. In fact, if you're feeling really cheeky, I would see your consultant and say, have you had any training on post-viral illness? Question it, because your health depends on it. Because trust me, when you are 10, 20, 30 years down the line and you haven't been able to leave your house, you feel incredibly angry at those healthcare professionals who said they knew what they were doing. Anyway, going now. Thank you very much. Take care of yourselves and rest up.